And I'm here again with my very welcomed visitor. And here we would like to continue our small talk, which we call Dina and Mina Show. It's an informal talk about why are we here and what brought us to Digital Health Days. And I'm immensely proud to present to you Cecilia, who is the CEO of international company who is helping people to cope with treating disorders. But at this point I will stop and I will give a word to Cecilia to basically give you some numbers, how they help people and how many people they already helped. Please, Cecilia.
Well, our company, Mando Group, Mando is Latin and means I eat. It originated from the Karolinska Institute, a section of applied neuroendocrinology. And we started to treat our first patient in 1993, and that was a severely ill anorexia nervosa patient appearing in the emergency ward at the Karolinska Hospital. Since then, we have 1,000 patients in full remission, and we see about 900 patients yearly in the Stockholm clinics. We have a clinic at the campus at the Karolinska Institute in Huddinge, and another clinic at Danderyds Hospital in the northern part of Sweden, and a third Swedish clinic at the west coast in Alingsås. And we also are situated on Upper East Side in Manhattan, New York, and in Melbourne in Australia. And we treat eating disorders and obesity. So some 10 years ago we started with morbidly obese children. And what are we doing? It's very simple. We are teaching patients how to eat and how to perceive fullness.
Okay, so what brought you here to Digital Health Days?
First of all, I think future healthcare is digital health.
Okay.
And I did participate last year as well, and I was thrilled about all the ideas and the creativeness and all technicians coming together. What I did miss last conference was the scientific data supporting the tools and the randomized controlled trials supporting the new methods of treating patients.
Okay, so that's basically what you're bringing this year, because I was listening to Cecilia's presentation, and basically now we will have a small demo of the product, and the fantastic thing about that it's all grounded into scientific evidence. So please, Cecilia, share with our followers on YouTube.
Yeah, so this is the 5th generation of Mandometer, and it is a thin scale which communicates wireless to a smartphone. And you put your plate with food on the scale, and the Mandometer stores the weight loss of the plate during the meal and generates a curve of eating rate. And then at regular intervals, you're asked to rate your level of satiety or fullness, and by pointing at the touchscreen. And then during training, you're presented with 2 curves, one for eating rate and one for feelings of fullness, and asked to follow these. And that is possible because you can see your own eating behavior on the smartphone while you are eating. So this is a biofeedback, device that assist patients, telling them how to eat, how fast they should eat, and when they should feel satiated. Because anorexia nervosa patients, they don't know how much they should eat, when they should be satiated, and how fast they should eat. And that's the same with bulimia nervosa patients and those we call eating disorder not otherwise specified, and as well as overweight and obese patients. They don't know how to eat.
Exactly. So I'm myself personally, I'm fascinated about the results you already have so far, but I would like to ask you, from your experience, what was the most interesting at the conference so far for you personally?
Well, I do think that all those creative ideas that are presented presented are just fantastic. I think there was in the morning a very interesting talk about the obstacles you meet when you launch new ideas and innovative ideas. There were many examples from the medical history, Helicobacter pylori, Semmelweis, etc. And I think it takes too long to implement new ideas in healthcare. And it's not only, it was mentioned that nurses and doctors are those who resist new ideas, but they are just part of it. It's also on a political level, it's contractors. It's difficult to exchange the old methods with the new ones.
So that's maybe one of the topics for Digital Health 2015.
That would be great.
And I hope that we will meet next year and you'll share maybe Mandometer 6 integrated with web-based application and platform, and we will have next recording session in 1 year.
I'm looking forward to that.
Thank you so much and good luck. Please, good luck with what you're doing.
Thank you so much.
Thank you.
Bye.
And thank you. And we are going to continue with another startup, which was very successful in Stockholm, which is called Hoas Tool Shop, and give a small glimpse on what they were presenting just in 5 minutes. Thank you so much for coming, but we will speak more as well.